plus residents of the city of Miami. While there's local information about chronic disease and social determinants of health across gender and racial categories in Miami-Dade County and the city of Miami, there's little to no health data in regards to Miami's lesbian, gay, bisexual, trans, queer, intersex, asexual plus community beyond HIV and AIDS. So they have a lot of information on HIV and AIDS, almost nothing on anything else. So an overview. The Accelerator plan provides infrastructure, support, and training that is needed to focus on the health of our community. To develop the Miami LGBTQ plus social determinants of health accelerator plan that will reduce this gap and provide a framework for PSE change within City of Miami's government, as well as within organizations of multi-sectoral sectoral partnerships engaged for this project to reduce this population's chronic disease burden. So the plan will focus on two primary things. It will be environment and social connectedness. And this is a project, a grant that's with the City of Miami and the Urban Health Partnership. So the goal is that we're working together with them, and we're going to do it for the City of Miami. And then the goal is to then get it to the county, right? Because we already developed something that works for the city, get it to the county, and then hopefully South Florida, and move from there. But we're starting small, right? We're starting with the City of Miami. And the LGBT Advisory Board, which I'm also a part of. How will this help? So Miami-Dade, Florida's Department of Health Community Health Assessment has chronic disease and data per race and gender, but not for the LGBT community when it's limited to AIDS and HIV. The information for the community simply does not exist within Miami-Dade County. This plan will create building blocks so the LGBTQ plus community and their health issues are not solely based on AIDS and HIV. The work we do will help local health institutes more inclusive for the LGBTQ plus community when gathering health data and developing future community health assessments. So the planning, where we just had a few meetings. So we finished the planning phase. We developed a leadership team, which I'm part of, a collective team, which is people that can't join the leadership team because of time commitment, but we still want to hear them because they're big in the world of LGBT and advocating. Focus groups, which will include residents, ranging from students all the way to elderly, to find out what they feel they need within the community. Surveys, obviously, to find out how we're doing, if we're doing anything that they feel needs to get done properly, and community meetings to kind of get all the information together and then do community meetings. So the built environment encompasses many aspects of our community, including streets, public spaces, parks, public transportation, and public community and cultural services buildings. How these are designed, utilized, promoted, and maintained has a significant impact on residents' sense of belonging and safety of whether these spaces are accessible for everyone. This is particularly true for the LGBTQ plus population, for whom fear is a common emotion in public spaces due to experiences of discrimination, harassment, and violence. So this kind of links in the Safe Place program, right? So if a business has a Safe Place program, now the community that has some fear could go in there to be able to call as well. Social connectedness. Avoiding public spaces and public transportation due to fear or lack of accessibility can lead to social isolation, lack of access to critical health and social services, less opportunity to engage in physical activity, and the reduced ability to build community and social support. These in turn can lead to development and worsening of physical and mental health conditions. Another huge thing that has to do with the community. So one thing that Michael is really big on, and we're focusing on the grant, is the PSE, the policy, system, and environmental changes. So this plan will include a series of policy, system, environmental changes, recommendations that could be adopted by the city's LGBTQ plus advisory board and the city at large. So the advisory board will let the commissioners know of what it could do to improve residents, we show them the money, right? How much money does LGBT community bring to the city? Because that's when they start listening, and then we captured their attention, and now we tell them, hey, this is how we can improve the people that live, play, work, and travel here, right? Focusing on safe spaces, the project will look at the community's resilience to the built environment and social connectedness. It will all tie back to health. Because at the end, mental health is also part of health, right? A lot of people always think health, they think they're going to the doctor because they have a pain. But you know what happens to the pain in your head, pain in your heart? Collective impact. So we're working together with the Florida Department of Health and Miami-Dade, Health Council of South Florida, Miami-Dade Area Health Education Center, SAVE, Survivors Pathway, University of Miami, Care Resource, Miami-Dade County, the Miami-Dade Gay and Lesbian Chamber of Commerce, and Forward Miami, and the police department. The only one. The completion of this grant to us to get all that information, work with the focus groups, the collective, is done September 2023. So by then, we should have gathered enough information and met enough to come up with a plan to present to the commissioners. And that's it. I'm pretty sure that's the last slide. I don't know too many answers to this, but I will try my best. So if you have any questions, I love it. You know what that means, right? It's 1:22. I finished right on time.